BPH. This is a normal finding in older male adults, males assigned at birth. What happens is the smooth muscle and the epithelial cells of the prostate gland start multiplying. It impairs the outflow of urine and can result in infection of the prostate gland. Risk factors for BPH include being male at birth, urinary stimulants like alcohol and caffeine are urinary stimulants. That's why we tell a lot of clients with urinary problems not to drink alcohol and to not drink caffeine. Anybody that's obese is going to be more at risk. The standard American diet puts people at risk. Hereditary father with BPH puts them at risk. People with metabolic syndrome, which I talked about in the diabetes lecture, are at risk. And then people obviously with diabetes and heart disease are going to be at risk. Prostate cancer is not a risk factor for BPH. The assessment findings of BPH can easily be remembered with the mnemonic fun pissed, which is almost like fun wise, but now they have more symptoms, so they're pissed, okay? F is for frequency, so they often have to go urinate multiple times a day. Urgency, nocturia, so greater than 4 times a night is considered nocturia. They have a poor stream. They also have problems initiating a stream. So just getting started. And then I is intermittency, so urine starts and stops suddenly, or they have an inability to void. They have a sense of not being able to empty their bladder, and they strain, and they may need to apply pressure to empty their bladder, like the Creday's pushing on the bladder. Ejaculation pain or pain on urination, that is a possibility. And they may dribble and they may have dysuria. Their urine can look like they have an infection with hematuria, bacteria, and WBCs. Oftentimes they're prone to infections because they're not able to get all the urine out. CBCs will show increased white blood cells, and if they have hematuria that is constant, they could have low hemoglobin. BUN and creatinine is only elevated if they develop kidney disease from it, and I'm going to show you how that can happen. Digital rectal exam will show an enlarged, smooth prostate. The PSA blood test is a screening test offered to males age 50 or greater. So this test needs to be drawn before a digital rectal exam. They cannot ejaculate 48 hours before the test or it's going to increase the results. They don't have any food restrictions. Just in general, a PSA is expected to increase with age. If they had a UTI in the last 6 weeks, that can elevate a PSA, so you would ask about that before you schedule them for that. And then a high PSA could mean that they have prostate cancer, BPH, or prostatitis. Medications that can alleviate the symptoms include finasteride, which may take 6 months to take effect. Remember, pregnant women should not touch this medication. And then tamsulosin, remember that this can cause orthostatic hypotension, so recall what all the interventions for orthostatic hypotension are. The surgical procedure to alleviate the symptoms of BPH includes a transurethral resection of the prostate, also known as a TURP. I took care of a lot of these patients when I worked in the PACU. The surgeon takes this scope and inserts it through the urethra, and then what this scope does is it rotor-rooters the prostate, like it shaves off the prostate gland to relieve urinary obstruction. After a TURP, your patient's going to come to the PACU with a continuous bladder irrigation or a Murphy drip. I've never had anybody on an intermittent bladder irrigation after a TURP. With this surgery, with these patients, it's like Groundhog Day. The PACU was like that anyway. They wake up and they start climbing over the side of the bed because they feel like they have the urge to void. So they're a fall risk when they first start waking up. You have to remember that. The purpose of the continuous bladder irrigation is to maintain catheter patency. Because the physician had rotor-rooted the prostate, little slivers of the prostate can clog up the catheter. And then what can happen with that is the patient starts developing bladder spasms. That's a sign to you that the patient needs to be manually irrigated because the bladder can rupture if you do not take care of this problem right away. All right, so that's really important. And anybody that's had a TURP is at high risk for DVT, and you already know what you need to do to prevent DVT. Okay, I'm going to go through the continuous bladder irrigation, also known as Murphy drip. Okay, so you have a three-way catheter, and there's a 30 to 40 ml balloon inside the catheter. So it's inserted in surgery. You don't touch that. The catheter is taped to the leg to maintain traction of the surgical site and prevent bleeding. Okay? You're going to monitor the INO. You want to make sure that that irrigation is constantly flowing and draining. You want to keep the irrigation patent, and after it's DC'd, the urine should be amber in 3 days. That's something you would tell your patient. So to look at it, you have the irrigant solution, and this has a double. I'm used to a single, but it doesn't matter. It's the same principle. See how it says this is the giving set? So this roller clamp would be clamped, and then this one you would open, and you would let the irrigant flow into the bladder, and then it flows out into the urine drainage bag. That's how the constant bladder irrigation works. If your patient is having bladder spasms, you're going to have to manually irrigate the catheter, okay? So what you would do is you would take this 50 ml piston syringe and you would irrigate it with sterile normal saline. And then you would call the provider if you are unable to dislodge the clot, because again, the bladder can rupture if you don't get that clot out of the catheter. Home instructions include increasing fluid intake, no sex or heavy lifting for 2 to 6 weeks.